All right, let's talk about Medicare today. We're going to go over, do you have to sign up for Medicare? When do you have to sign up for Medicare? Why do you have to sign up for Medicare? How to sign up for it? Do you have to sign up for all of it? What is A? Do you have to sign up for Part A, Part B, Part C, Part D? Yes, there is a Part C. What about Medicare supplements, Medicare Advantage, all of it? So if you're a veteran, do you have to sign up? If you're going to be moving overseas, do you have to sign up? All of those things we're going to discuss today. And as usual, at the end of it, I am going to open the floor and I'll be answering any and all your questions. I've got a little bit more time today than usual. Usually I answer all your questions about an hour or so, but I got a little bit more time today, so I'll try to go as long as humanly possible. I've got my cup of coffee right next to me, and let's go ahead and get started. So if you got questions, just go ahead and start typing them in the chat. If you just are here for the first part, so we're just talking about all things Medicare for the first 10 or 15 minutes or so. And then if that's all you need, then we'll see you. But make sure you subscribe. And that way, if you do have questions in the future, then you can come on back. If your family, friends, relatives, coworkers, person down the street, or whoever the case may be has any questions, you can find us in the future. All right. So the Medicare part should take about 10 or 15 minutes, and then we'll open the floor for about an hour or more for all your questions. All right. So original Medicare. So original Medicare is what they call Part A and Part B. So Part A covers your hospitalization, and Part B covers your doctors. So you have to sign up for that at 65 years old, unless you have health insurance from work. If you have health insurance from current work, this is important, has to be current work. It can't be COBRA. It can't be, the Affordable Care Act, Obamacare, the health marketplace. It can't be anything like that. It can't be a retiree plan. It has to be from current work, your current work or your spouse's current work. So if you have health insurance from current work, yours or your spouse's, then you don't have to sign up for Medicare. But that plan has to have 20 or more employees. Okay, 20 or more employees. As long as your company that you work at or your spouse works at has 20 or more employees, and obviously you're happy with your health insurance. It doesn't cost you an arm and a leg, and it covers things. It doesn't have a crazy deductible or anything like that. If you're good with all of that, then you do not have to sign up for Medicare. You don't have to do anything. If you are currently receiving Social Security benefits, you do have to do something, because when you turn 65, about 100 days or so before you turn 65, Medicare will send you your packet automatically with your Medicare card in there. So they'll already enroll you automatically. But if you have health insurance from work, you just return it, and it'll give you instructions on there exactly how to refuse it, and no harm, no foul. And then later on, when you stop working, you or your spouse stop working, or you decide that your company health insurance is just getting too expensive and you want to switch to Medicare, then you can do that in the future. And I'll talk about how to do that here in a little bit. But this applies for people that are, again, turning 65 or that were on disability. If you're on disability for 24 months, the 25th month you get Medicare. And same type of situation, it's automatic, right? Your Medicare card will come in the mail. If you're not receiving Social Security benefits and you want to go ahead and sign up for Medicare, then you do have to do something. You file an application online, call the 800 number, call Social Security, the 800 number, and schedule an appointment. And you can restrict your application. Basically, you can say, all right, I want to go ahead and start my Medicare when I'm 65, but I don't want money. I don't want my benefits to start because, I want to wait until I'm, retired, or I'm making too much money now, or I want to wait till my full retirement age, or I want to wait till 70, delayed retirement credits, or whatever the case may be. All right. So in terms of how much all that is, Part A, there's no premium. If you paid into Social Security for 10 years, the 40 quarters, then you've already essentially paid for Part A. So you get that for free. The premium part, there's deductibles and everything like that. But in terms of the monthly premium, there is no charge for that. If you didn't, then it's pretty expensive. It really depends on a lot of variables, how many quarters you paid into and everything. But in terms of Part B, $174.70 this year. And that is pretty much what everybody pays, unless you're what's called a high wage earner. And this goes back 2 years ago. If this year is what, $103,000 for a single, a little over $200,000 for a married couple. If you earned over that, and this goes back 2 years, it looks back 2 years. And if you went over that, then there's going to be an extra premium for your Part B. And I've got a video on that. And if you got any questions, if you got a letter that says your IRMA has kicked in and now you're paying $300 or $400 for your Part B, then just let me know. Ask the question, and I'll walk you through the whole process and see if we can get you a life-changing event, as what they call it. All right. So what happens if you don't enroll in Medicare at 65 or after being on disability for 24 months? Again, if you had that ability not to sign up at the time because you were working or anything like that, then you can qualify for what's called a special enrollment period. Okay, so the special enrollment period is basically, you're working, you have health insurance, and then 5 years later you retire at 70 years old, and you stop receiving health insurance from work at 70 years old. You technically have 8 months from that time, when you lose your health insurance, to sign up for Part B, and there's no penalty whatsoever. Legally, you have 8 months, but you know what happens when you don't have health insurance for 8 months? That's when you actually get sick or fall or whatever the case may be. So I recommend everybody does is a couple, 3 months before you're going to lose that health insurance, sign up for Part B. And you will need a couple of extra forms. It's 564 and the 40B. I've got a video on that. It walks you through the whole process. It's just a couple of simple little forms. One that you fill out saying that I want to start, your Part B, and the other one you take to your HR, and your HR fills it out to basically say, okay, this person had health insurance since they turned 65. So it's pretty easy. And then you just submit it to Social Security, and they start your Part A and Part B at that particular time. All right. So if you don't have that special enrollment period, then you will be in the general enrollment period. So if you just completely forget to sign up and you don't have health insurance that's acceptable, then you have to wait for the general enrollment period. And that is between January and February, January 1st and March 31st. So January, February, March, you can go ahead and sign up. Let's say you sign up in January, your benefits will actually start in February. They just changed the law last year. Before, if you signed up in January, February, March, your benefits, your Medicare wouldn't start until July, but they just changed it, which is a beautiful thing. So you sign up in January, your Medicare will start in February. If you sign up in February, it'll start in March. If you don't do any of this, again, if you delay, let's say you're supposed to sign up at 65, you don't have health insurance from current work, and you decide to sign up at 70. You walk into the office in January at 70 years old, and you say, I want to go ahead and sign up. They say, okay, no problem. We'll go ahead and sign you up. All right, your Medicare starts February 1st, but you're going to pay 50% more than everybody else, because you're going to have a penalty, 10% for every 12 months you did not have health insurance and you didn't fall under one of those exceptions, current insurance from work or anything like that. So there's that penalty, and that's for the rest of your life. So 50% times whatever the Part B premium is at that time. And this also includes Part D, the prescription drug plan. So you're going to pay a penalty for prescription drugs for the rest of your life. I see a lot of people signing up for Part A and Part B, and then they go get a Medicare supplement plan or a Medicare Advantage plan that doesn't have Part D in it, because they say, I don't take any drugs, so I don't want any of that. And then a year, 2 years, 5 years, 10 years later, they sign up for that Part D, and they have to pay a penalty for the rest of their life. It's not the 10%, it's actually 1% for every month they're supposed to have signed up but didn't. And again, that's for the rest of your life. If you So some people go ahead and file at 65 and start their Medicare Part A because it is free, the premium that is. And they just said, okay, I'll go ahead and sign up for Part A, but I don't want Part B because I currently have health insurance from work. But A is free and it doesn't hurt to have extra coverage. So a lot of people do that. But if you have an HSA, Social Security employees won't tell you this because they don't really know the ins and outs of Medicare as well as they probably should. The HSA, a health savings account, if you're currently contributing to an HSA, once you sign up for Part A, you can no longer contribute to the HSA. You can withdraw your funds, but you can't contribute anymore. So make sure you do read the comments on some of my videos, and you can see people, they get penalized by the IRS and all this other kind of stuff because they didn't know that. So make sure if you have an HSA, then you either have to stop an HSA or not sign up for Part A. If you have VA, a lot of veterans say, well, I don't want to sign up for Part B because it's $174.70, and I don't want to waste that money because I use the VA. Again, this is Veterans Administration. This is not TRICARE. TRICARE is for retired military. Like me, I was in the Marine Corps for 8 years, and I don't receive TRICARE because I'm not retired, but I could conceivably receive Veterans Administration benefits. But so a lot of vets receiving VA benefits, and they go to the VA hospital and they're happy with the VA hospital. So they say, I'm not going to sign up for Part B. It's fine. Don't have to. You're a veteran, you're ex-military, don't have to do anything in your life, but the repercussions are the repercussions, right? So if you decide to move and the new place you move to doesn't have a Veterans Administration that you like, the VA service deteriorates, you want to get a second opinion or whatever the case may be in the future, I would definitely consider, make sure you really think about whether you want to pay that penalty for the rest of your life. Because again, you might be happy with the VA today, but what happens next year or the year after that? And you decide, okay, well, yeah, I want to go ahead and just start using Medicare, or I need a second opinion or something like that. And you go to sign up, and you can't do it till January, and then you'll pay a penalty for the rest of your life. So consider that wisely. Same type of thing, living overseas. Got a lot of people ask questions about, okay, I want to move overseas, and do I need Medicare? Well, Medicare doesn't work overseas, but if you're going to move overseas and 100% for sure you're never coming back, you're never going to get sick, you're never going to get injured to where you have to come back, and you can get everything done wherever you're going to go, then you don't have to sign up for Medicare if you don't want to. But you're only going to penalize once you sign up. So if something happens over there, you just don't like it, there's a coup or something, or whatever the case may be, you get sick or injured and you have to come back to the United States, then again, if you come back in July because of an injury or something like that, you can't get Medicare until February 1st. Well, you sign up in January, won't get till February 1st. And then again, you have to pay the penalty for the rest of your life. So make sure you make those considerations. All right. So, and then, so you've got Part A, which is again, hospitals, covers the hospitals. Part B covers your doctors. And it's called Part C. Some politicians are trying to make it not be called Part C anymore because these are private companies. Those are Medicare Advantage plans, Part C. And a lot of those get wrapped up with Part D. The Part C, the Medicare Advantage plans, a lot of those have Part D, the prescription drug plans, in there as well. And then there's also Medicare supplement plans, which are like traditional kind of insurance. They cover most of the gaps of what A and B doesn't have. And then if you get a Medicare supplement, you also need a Part D plan. A lot of people that get Medicare supplements don't get a Part D because they say, I don't need drugs, and then they pay for it later. And then the Medicare supplement, so you'll need a Medicare supplement, you'll need a Part D plan, and it doesn't come with the any of the extras, vision, dental, hearing, or anything like that. So you can get a separate plan on that. So that is did it in 15 minutes, so that's not too bad. There's always a billion questions when it comes to any of that. I'm going to do another video here probably this week in the next few days on all things I just did one on the differences between Medicare supplement G and N. and I'll do another one in the next few days on Medicare Advantage. All right, so probably have tons of questions out there. So let's move into the question part. Oh, and we already got somebody already bought me a morning coffee. Good time, $1.99. Thank you. All right, appreciate it. Thank you. All right, let's see. We got Donna. What's up, Donna? Hey, Dr. Ed, my friend is on SSDI and workers' comp. Is she also able to get SSI? Thank you so much for all you're doing for all of us. You're welcome. You're welcome. If so, it depends. So SSI, you can get SSI and SSDI at the same time. SSI is a supplemental security income. It's a welfare-based program. But if your SSDI is over basically 900 and some change, then yeah, you wouldn't qualify for SSI. She might technically qualify because she's disabled, but SSI is a needs welfare based. So you have to have limited income, limited resources. And if her SSDI is over 900 and change, then she won't be able to get SSI at all. The other part of the question is, yeah, workers comp. Yeah, so if she's getting SSDI and workers comp, then she's probably making too much money on a monthly basis to get SSI. Supplemental only available after 65. What if on SSDI? Yeah, no, it's the supplementals. That's yes, much to my chagrin and everybody's. It depends on your state. For people 65, they're in that golden period when they're 65, a few months before, a few months after, they can get a supplemental plan and there's no health questions or anything like that. But it depends on in your state. Some states mandate the insurance companies to offer Medicare supplement plans. So you have Part A and Part B, and then you want to, cover all the, the gaps. Like the big one is Medicare Part B, the 20% coinsurance. So if you have a $100,000 bill from the doctor, you have to pay $20,000 out of your pocket. So a supplemental plan, they're also called Medigap plans because they cover the gaps. So you can sign up for that and you still keep your original Medicare. But some states mandate companies offer those, but other states don't. And even some of the states that mandate insurance companies to offer supplements, they don't offer, let's say the good ones, the ones that everybody sign up for, which is the G or the N. They offer, there's 10 different plans, and some of them are, you look at it and it's like pretty much nobody gets them because number one, they don't cover that much. And number two, they're crazy expensive. And even on the G or the N, if you live in a state that doesn't mandate and doesn't also control the prices, then yeah, you're going to pay a lot of money if you're under 65 for a Medicare supplement plan. So that's why people get a Medicare Advantage plan if they can't get a supplemental plan in their state. And then when they reach that magic 65, then they can get any supplement plan they want, G or N, and they can't be charged extra. They can't be denied. The person that signed you up, and again, I've got a network of partners throughout the country that can help you look for a plan, but they don't ask you any health questions except for tobacco, because you're rated. It's a little bit more expensive if you're a smoker. So, but that's depending on state as well. So even though Medicare is a national program, insurance is regulated by the individual states. All right. Kay, hello. I am interested in finding info on newly 3 years, 65-year-old disabled spouse. What kind of info are you looking at? Let's see here. Patty, I don't know if I've seen any other YouTuber address this, but folks should know if they work and collect and have SS payments withheld, that money gets added back when you hit 65 or 67. Correct. Yes. I talk about that all the time. But yes, 100%. I just talked about this yesterday in my live yesterday. I'm trying to do a record. I'm trying to do like maybe 100 days of live every day. But anyway, so yeah, if you collect your Social Security early, let's say 30 months early, and then after 10 months, you do like me, took 10 days for me, say, well, this retirement thing ain't for me. Let me go see, what kind of trouble I can get into. And you go back to work, then you've only taken 10 months early. When you hit your full retirement age, the Social Security computer system looks back and says, okay, your benefits is reduced by 30 months, but you didn't use 20 of those months. So what they do is they recalculate your benefits, and your benefits for the rest of your life are only reduced by 10 months, what you actually took it. So yes, yes, yes. Thank you, Patty. Awesome. Another piece of information. And because, yeah, when, even if you collect early, you can go back to work. If you're going to be earning over, the $22,320, which is the limit this year, Social Security holds back $1 for every $2 you go over. It's different once the year you hit your full retirement age, and then once you hit your full retirement age, you can make $1 million a month. But if you're 63, 64, and you retire, start collecting your Social Security, but then get offered a job or whatever the case may be, then you can stop your benefits. Just call Social Security and says, yeah, I'm going to make way over that amount, the $22,320. So go ahead and stop my benefits, and they can do it, and then just restart it later on. Yep, easy, easy, easy. All right, pop this one up. What if one is something 65 and still has insurance coverage through work, but the company were to have fewer than 20 employees? So yeah, so that doesn't count. What happens is the employee is still considered to have, no, that is not credible coverage, because it's a thing with first payer, second payer, and all that. Yeah, it's a bureaucratic thing. But yeah, if less than 20 employees, then that is not credible coverage, and you will be penalized, unfortunately, for the rest of your life if you don't sign up for it. K, would rather listen than post publicly. I am a caregiver now, working full time. He received long-term disability, Social Security, and pension. Okay. All right. So let's see. There's like he is. Yeah, I almost didn't see a question. Question: was disabled in '96. My husband retired 2012. His employment did not get letter of health insurance in time, therefore penalized. Currently 62 with this penalty fell off when I turned 65. No, yeah. Unfortunately, the penalty will go on forever. So the employer did not get letter of health insurance in time, therefore it's penalized. So yeah, I mean, if you can prove if he can prove that he had health insurance from that time when he was supposed to sign up to when he actually did, if it was a 2-year period or something like that, and you can go back to the company and get that proof, I would 100%, I would submit it. I think we had, and again, I ran the third busiest office in the country, and helped thousands of people every day. But it's there's always exceptions, and there's always strange situations. And I don't think I've heard of this one that I think we had 2 or 3, or no, I think we've had a few of those, but I never followed up, and someone else in the office was taken care of. I never heard what happened. But with anything Social Security, anything with the government, doesn't hurt to ask. So I would go to that company, and I would have them fill out the 564, which is basically proof of employment and insurance. Have them fill that out, take it down to the local Social Security office, submit it, and see what happens. Yeah, absolutely. And then let me know what happens. Yeah, that's yeah, let me know what happens. Can you explain the file and suspend rule in reference to spousal benefits? Yeah, that stopped in 2015. Well, technically 2016, but yeah, it's basically where husband and wife, the higher earner, wife or spouse, whatever, the higher earner would file, then suspend, and that would allow the lower earning spouse to continue to collect their own benefits and spouse benefits, but you can't do that anymore. So there's that. So if you're married and one spouse wants to file on the other spouse's record, number one, they have to file on their own first. And if they're currently married, the higher earning spouse has to file and be receiving benefits for the spouse to be receiving benefits. So, Tamara, what's up? Hi, Dr. Ed. If I apply for ex-spousal benefits now, will I automatically receive survivor benefits later? Absolutely, absolutely. Yes, you will be on the record on the MBR, as what it's called internally, master beneficiary record. You will be on there, and so if you're completely out of touch with that person, um, what usually happens is, I've seen this all the time, spouses, divorced spouses married to someone, decades ago, and they were married to them for 10 years and they're starting getting their spouse benefits. And then one day their check increases and they call up Social Security and says, hey, check increases. Well, person passed away. Oh, wow, I didn't know that. So yeah, no, it's automatic. You don't get the lump sum death payment, that $255. I know you're crying about that. I wish they'd do something about that. Yeah. So because the $255 is kind of like burial, so you're not involved. So it goes to the current spouse or the children or something like that, if the children are on the record. So, yep, it's automatic. You don't have to do anything. All right, Cheryl, is it mandatory if you have the Advantage plan, your PCP determines the specialist or surgeon is? Um, I don't think I don't think it's yeah, the Medicare Advantage, I'm going to talk about the Medicare Advantage ones, because there's networks and, you have to go kind of through the gatekeeper in order to see, specialists and stuff like that. And you have to get pre-approval and pre-authorizations and networks are always changing. But I'll talk about that in a few days. But in your particular case, I don't think I've ever heard of, obviously there's a network that you have to go through. And if the specialist that you want to go see is the only specialist covered by your insurance company, then I guess you got no choice. But if you got other options and that those other options are in your insurance company's network, then I would reach out to the insurance company and say, hey, I want to go to another one. And that shouldn't be an issue. I've never heard of it being an issue. Let's see here. Do I have to choose Medicare if I have insurance through my estranged spouse and Medicaid? Can Medicaid drop me if I decline Medicare? So you might be in a good situation because if you have Medicaid, what Medicaid, before I worked for Social Security, I worked for the Department of Social Services doing Medicaid. But Medicaid, the states like to sign you up for Medicare because that moves costs over to the federal government, even though Medicaid is a state-federal partnership. So rather than paying your health care, they're like, hey, we'll pay for your Medicare and we'll have the federal government pay for, all your health care and stuff like that. So yeah, once you're eligible for Medicare, you're 65 or, disabled for 24 months, then call up Medicaid and say, hey, I'm going to get Medicare here pretty soon and I don't want to pay that $174. Hook me up. And it's called the Medicare Savings Program. And it depends on what level of Medicaid you're receiving, the QI, the QMB, SLMB. If you're getting those, then you just might be eligible to get your Medicare paid. But if you have, it has to be a spouse's current work. So, all right, let's see what other kind of questions we've got. I've got a TikTok here as well. I apologize, TikTok. I need 10,000 subscribers to show you all my screens and all that kind of good stuff. So please subscribe. But let me see here. If my husband dies and I take his Social Security payout, do creditors have the right to guarantee? Yeah, that's not really something I can address, but they can harass you all they want, whether you pay them. I guess it's Dr. Ed. Thank you so much. God bless you. You're welcome. Welcome. How early can I apply for Social Security if I turn 62? August. Yeah, 3 months is plenty of time. I've taken hundreds of thousands of retirement applications, and if everything is good, go in there, go into SSA.gov, set up a My Social Security account. check your earnings. Everybody, please check your earnings. Tax season just finished. Check your earnings to make sure you file your taxes. You notify the IRS how much you made, how much you paid, and the FICA and all that kind of stuff. And the IRS notifies Social Security, and you want to make sure it gets to Social Security and everything is correct. Like they used to send out the statement. Many years ago they used to get once a year, but now you have to go online. So go online before you retire and make sure your earnings are correct. And if there's anything like a 0 year there that you worked, then come on back here and I'll walk you through the whole process of how to get that fixed. But yeah, a couple of 3 months before is plenty of time. Those, if your earnings are correct and everything looks good, and you might not even need your birth certificate if you were born in the United States and everything is correct to your date of birth and name and everything is correct, then yeah, I've taken hundreds of thousands of those and get them done in 20 minutes. So by the time you walk out of the building or they hang up the phone, your claim is adjudicated. So very, very easy. All right, let's see here. Yeah, 2 or 3 months before. You don't want to do it too early because then they can't push the button until 3 months before. So people say, well, I'm going out of country, so I have to do it 5 months before. You technically can do it, but then the claim specialist has to sit on it for 2 months and something happens to them, it gets all messed up. And so, yeah. Let's see here. My friend diagnosed with stage 4 cancer. Wow. Can disability process be sped up? Yes, yes, absolutely. Yes. If they've already filed for disability, they've got this, Social Security's got a great system. It's kind of like an algorithm type thing. I have taken cases, disability claims for, people with stage 4 cancer and really serious illnesses and disabilities, and push the button, send it up to the agency that makes the medical determination, and then it comes back like the same day or the next day approved. So yes, absolutely. Please call Social Security, and the claim specialist that took the claim, and make sure they know that she is, if she had stage 3 and then moved on to stage 4, whatever the case may be, because they should have done that. If she filed a claim and instead had proof that she had stage 4 cancer, then you know it should be done. What is it, 4 o'clock or so West Coast time, so it should be done by today if she filed this morning. I mean, tomorrow morning. Let's see. If you are 67 and you go back to work, do you have to stop your Social Security? No, no. At your full retirement age, you can make $1 million a month, and if you do, make sure you buy me a coffee. But yeah, no. If you go back to work at your full retirement age, then you make $1 million a month, and no harm, no foul. I did a video a few days ago. If a, a kind of insider tip that almost nobody knows is that once you hit your full retirement age, you can actually suspend your benefits if you want to. If you've got other income, or you're going back to work and you don't need the extra money and you think you're going to live a long time, then you can actually suspend your benefits and suspend them, as many months you want. But if you suspend them all the way till 70, then you get that 24% bump. So it's called a voluntary delayed retirement credits. And it's that pretty much nobody knows about. So, all right, let's see here. Greg, when you call Social Security 800 number, do they know as much as your local office? That's yeah, no. 800, no, their teleservice center, that is just, they know a little bit about everything, but the real deep stuff, even at the front windows at your local district office, I had close to 100 employees in my office, and they were pretty well balanced out. About a third of them were what's called CSRs, customer service representatives. So they're the hardest working, but the hardest working, lowest paid, but they were the jack of all trades, but they weren't masters necessarily of one thing. And then another third of the office is what's called Title 16 CSs. That's the SSI. They do the SSI disability. And then the other third of the office is what's called Title 2, which is the regular retirement survivors, SSDI. So if you're looking for a specific claim type of thing, then you need to talk to a claim specialist. And then there's also people called technical experts that should really, really know their stuff in a particular offices. So there's too much of the sausage being made that you probably didn't want to know. But anyway, I am currently employed and have an HSA and am on Medicare. My employer contributes monthly to it, but every year they take out part of my vacation or sick to pay to add to it. Is this, I don't know about that. Yeah, the legality of any of that. But yeah, if you have an HSA, then yeah, and Medicare Part A, then yeah, you can't legally, well, I guess you can't legally, but then the IRS is going to come back and say, "Hey, you shouldn't have put that money in there. You shouldn't have got the tax benefits of the HSA because you had Part A." So yeah, once the IRS notices that you have Part A and there have been contributions to your HSA, then they're going to say hello and want their money back. Let's see here, Jimbo. Hey, what's up today? One of my regulars here. I'm going to retire in the Philippines and keep my Medicare Part A. If something serious goes wrong, I could fly to Guam or Hawaii. That is right. Is that right? And of course, I hit the like button. Okay, awesome. Yeah, everybody press the like button. Jimbo's always looking out for me. Yeah, but Part A covers the hospital, but that covers the hospital. So if something happens in the Philippines and you have to go back to Hawaii, you know, my son was born at the Tripler Army Medical Center in Hawaii there when I was stationed at Camp Smith in Kaneohe Bay. So big facility there, good facility. But yeah, if you go back there, um, Part A covers the hospital. Obviously not going to go to Tripler unless you're a veteran, but anyway. But you go back there but it covers the hospital. But when the doctor comes in and actually does something to you, does the surgery or anesthesia or whatever the case may be, that's Part B. So the Part A is going to be covered, you know, your night stay in the hospital and stuff, but everything else, the actual healthcare part of it, that's Part B. So you'll have to pay out of pocket for all of that. Tomorrow became a member. Awesome. Thank you very much. Thank you, thank you, thank you. All right. I appreciate it. Yeah, it costs a ton of money. My wife is not happy about how much retirement money I've spent doing all this, but people always showing some love every day. I really do appreciate it. I turn 65 next April. So I guess, okay, next April, and I'm still working, not ready to collect Social Security. Do you get a monthly bill to pay Part B? Yes, yes, yes. Good. Not monthly though. They usually do it on a quarterly basis. So if you're not receiving Social Security benefits at that time, then they'll bill you. And then there's a couple of other three ways that you can also pay for it. You can go on. There's like a automatic pay type stuff. So yeah. And then once you start your Social Security, it'll automatically start to be taken out of your Social Security check before you get it. Greg. How often my Social Security account update? How often is it updated? Yeah, whenever there's new information. Usually, you know, when you work and you know the previous year's work makes it through the IRS, and the IRS notifies Social Security, and then so we're talking, you know, April, May, June, July, or whatever. Everything is updated, so your new earnings are put in there, and then everything is recalculated, you know, based on, you know, how much you're going to get when you retire and all that kind of good stuff. So yep, yes, please check it. And I agree, it's a nightmare to set up a my Social Security account. It's, you know, this password and ID check and all this kind of stuff, but it's for your protection. It makes it very difficult for anybody to go in there, pretend to be you, and go in there and set up an account. And, you know, when you start receiving benefits, change your direct deposit or address, or start, make trouble for you. So Social Security makes it very difficult to do it, to prevent those people from pretending to be you. And because of that, it's going to make it difficult for you. And I apologize, but it is crazy difficult to set up an account. Sometimes it's very smooth, but sometimes it's, you know, they ask you all kinds of challenge questions. You know, did you ever live at this place? And if you answered it wrong, then yeah, sometimes you have to go down to the local office and get it, unsuspended. But if you set it up, then it makes it even 10 times harder for someone to go in there and pretend to be you and mess things up, because if someone goes in there and pretends to be you and you've already set it up, you will receive an email because you've registered your email, or a text messages because you registered your phone number. And it'll say, hey, John, looks like you're having a problem getting your account. And you're like, wait, I didn't get my. So you immediately go in there and change your password, and that person is shut out. So yes, set up an account, please, please, please. Lisa, if Part N covers a lot of what Part B does, can you choose Part N instead of Part B, or in addition to it? Yes. No, no, no. Yes is yes to the last part. Yeah. So Part N and Part G cover some of the things that Part B don't cover, but Part B does cover a little. I actually did a little graph, so don't laugh at my graph abilities here. But here is so this is a old plan. Again, sorry TikTok, I need 10,000 subscribers so I can show you all my stuff, so please subscribe. So this is Plan F, and you can't really get that anymore, and even if you could, you don't want to, because it's expensive. So Plan G covers all the major gaps except for the deductible, which is only $240 one time a year. But Plan N doesn't cover the deductible, and it doesn't cover what's called excess charges, and those are not very many doctors. Oh, let me take this thing out of the bottom so you can see my little thingy there. Let me hide that. Okay. Yeah, so Medicare Part B excess charges. Some doctors, clinics, facilities throughout the country charge more than what Medicare allows. And Medicare says you can only charge up to 15%. And most of them are like podiatrists and psychiatrists and stuff. Yeah, so not many people, have the excess charges. But so it covers everything else. It covers the co-insurance. The big thing is it covers the Part B, that 20%. So Plan G covers that 20%, and Plan N covers that 20%. But Plan N doesn't cover 100% of that because you have a few little co-pays. Like if you go to the doctor for a diagnostic, you have to pay up to $20 copay. If you go to the emergency room, it's up to $50 copay. And unless you're admitted to the hospital, if you're admitted to the hospital, then they waive that $50. So there is that. So yeah, so in order to get Plan N or Plan G, you have to have Medicare Part A and Part B. So, all right. And again, you cannot be denied for a Medicare Advantage plan. You cannot be denied for a Medicare Part A. You cannot be denied for Part B. You can be penalized and all that stuff, but because of pre-existing health conditions, you can't be denied Medicare Part A, Part B, Part D as in dog, the drugs. Part C, you cannot be denied the Medicare Advantage plans. You cannot be denied for, Obamacare, the Affordable Care Act, health insurance is all the same thing. But you can be denied for a Medicare supplement plan. It's based on health rating. But if you're 65 and you're new to Medicare, even if you're 70 years old and you just signed up for Medicare because you had, a credible coverage, then they can't deny you at that time as well. And there's a bunch of other little strange situations. It's all very, very crazy and complicated. Yeah, if you want help finding a plan, I make no secret that I recommend Medicare supplements. I recommend actually Plan N, and then Plan G just a hair under that. So and energy if it's in your budget. If it's not in your budget, then Medicare Advantage. And again, I'll talk about that here in a few days. All right. Just Jeff. What's up, Just Jeff? Just found this channel yesterday. Already a blessing. Thank you. Thank you. Excellent information. I'm researching the Ticket to Work program. Is it true my medical will remain while in the program and beyond? Yeah, the Ticket to Work program, if you get someone in there, so that is someone that's on disability that's looking to transition to the workforce, and Social Security is all about, yes, it saves the trust fund, and you're going to make more money if you probably go back to work, and it be fulfilling, and hopefully you find something that you like and all that kind of good stuff. So Social Security wants you to go back to work. So that's why they've contracted with this company, this organization, Ticket to Work. So you call them up and they help you out, and make sure you stay legit, and because there's all kinds of it's complicated. You got the trial work period for 9 months. You can make as much, you can make $1 million a month for 9 months. Doesn't necessarily has to be consecutive, to try work. But after 9 months, if you still want to make $1 million a month, then your Social Security stops essentially. If after 9 months you say, well, yeah, I just can't do it, my disability just doesn't allow me to continue, then no harm, no foul. Yeah, and then after that, there's an extended period of eligibility for 36 months, and every time you go over a threshold, then you don't get your benefit for that month. And yeah, it's all. So trial the Ticket to Work is a good resource to reach out to, and please, please, please. I did a video on this. I did a 4-part video on this, on disability, about working. But keep a journal, and then write in the journal, hey, I talked to John at the Ticket to Work today. Today is whatever date, and they said I'm good and I can work this much more, and yada yada yada. And you can also reach out to, in your area, there's over 1,500 Social Security offices throughout the country, and each area has what's called an AWIC, an Area Work Incentives Coordinator. And that person is an actual Social Security employee in one of your local district offices that is supposed to be a specialist on all that too, and help you out. So call up the Ticket to Work, and if you don't get really, really good service and you're still kind of confused, call your local AWIC, and you can go to ssa.gov, and just type in AWIC, and it'll give you the contact information for the AWIC in your area, and reach out to them. But be aware, sometimes those AWICs, they're kind of voluntold. In the Marine Corps, it's like, yeah, we need a volunteer. You breathed, so you're the new AWIC. You're the, yeah. So yeah, sometimes, yeah, they're good. Sometimes they're great. I was trying to put that diplomatically. Donna, I have Plan G beginning this month, and in a year from now, if I wanted to switch to Plan N, would I still be in the golden rainbow, in the sense that they accept me without tons of medical questions? No, but if you are healthy, and they don't do like a medical exam and stuff like that. The person that signed you up, and again, if you want someone to help you, I've got, email me or call, and we can find someone. But yeah, the person that enrolls you and finds you a Plan N in your area with a good company and a good price, they do the application and they ask you 20 or 30 questions. Have you ever had this, heart surgery, and or do you have, diabetes with this much of insulin and stuff like that? And if you say no, 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 no to all that, then you're done, approved. But if you say 1 to particular ones, then you're automatically denied. If you say yes to other ones, then they do a little bit more research, and maybe it takes a couple of days to approve you. But yeah, I mean, it doesn't hurt to try. There's a lot of people switching from G to N, because even though, in your state, the G just might be, 10, 20, 30, 40, $50 extra a month. Pretty much everybody projects that G, the prices increases of G are going to go up quite a bit more than N, because G is easier to get. It's a guaranteed issue. It's just sausage type stuff. But yeah, N prices look to be more a smaller increase over the coming years. Tim, funny you're on here today about Medicare. I got an email from Social Security this morning about Medicare. I'm thinking about getting the free Part A, I think it is, and use my work insurance for everything else. Anything else? Yep. Sounds like a plan. Yeah, if you have, so you're just 65 there, and they sent you all the stuff, and you also probably, when you're 65, every insurance agent in the country and every insurance company in the country that offers a Medicare Advantage particularly, yeah, they want to take you to the 65-year-old prom. Feel like, it's like being a homecoming queen or king again, right? Everybody wants to take you to the prom. You get garbage and emails and phone calls and, all this mail coming in. Yeah, sign up for this, sign up with us. Yeah, it's crazy. But yeah, if you have health insurance from work and you're happy with it and all that kind of stuff, yeah, sign up for Part A. Yeah, it's free. The premium, that is. And once you stop working, then fill out those two forms. Start your Part B again about a month or two before, and that way, your insurance from your work will stop, and the next day, Medicare will start the next day. Let's see here. Tammy, I did go back to the company. Unfortunately, the records only go back. Oh, okay, so you did try to go back to the company and get the 564 completed to show that you had that, or show that he had credible coverage during that period. I do have past letters from insurance companies. I paid over $400 a month due to penalties. Wow. Um, all right, yeah. So if the company, I I would try it. I've seen stranger things. Working at Social Security for a few decades, I've seen stranger things be approved. So, but this ain't a strange thing at all. This is, yeah, this should be. It should have been done. Obviously, originally the company should have done the right thing from the beginning. But have them maybe try this. Have them write up a letter that says, um, you know, sure they don't have records, but yes, he was an employee from when he turned 65 until whenever, that time period. He was an employee from, he was an employee from whenever to whenever. And, maybe something to the effect that even though they can't prove health insurance, maybe put down there, and employees of that time, and he was a full-time worker, had health insurance, something like that to kind of show that part of it. And then reach out to the insurance company and see what type of proof they can give you. So you don't have one thing you can hang your hat on, but you have what's called preponderance of the evidence. So between those two, I would submit that to Social Security and yeah, and see what happens. Because if they approve it, then what they'll do is they'll say, okay, well, yeah, this person should have never gotten those penalties. So we'll go ahead and return all the penalties going back from the beginning. So that's going to be a chunk of change. So I would probably, yeah, that's going to be a really chunk of change, isn't it? So I would definitely do that. And if they deny you the first time, then file a reconsideration. If you forget how to do all this, just come back here when I'm live again and file reconsideration, SSA 561, and say, hey, I disagree with your decision. I think you should have, taken this as a preponderance of the evidence. And then someone else from the office will look at it again. And if they deny it again, then I would go to the administrative law judge. Administrative law judge has a lot more latitude, a lot more freedom to kind of read in between the lines. And they would probably approve something like this. I'm not sure, but yeah, I've seen ALJs approve all kinds of strange things. So again, that's going to be a chunk of change. So it'll take you like a year to say the administrative law judge, but during that time, you're paying those penalties. But if the ALJ says good, then he'll mandate the Social Security pay everything back. So I think that's worth filling out a couple of forms. All right. Tomorrow, I meant, will I then receive his full retirement benefit, not just the 255? Yeah. Yes. 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 You'll well, if if you're your full retirement age when he passes away, then yes, you will receive essentially what he was receiving. Yes. Leslie, if I'm taking my Social Security and later my ex-spouse dies, can I claim surviving spouse and get his full amount? Yeah, same. Yep. Y'all are on the same page. If I'm taking my Social Security and later my ex-spouse dies, yeah. So if you're taking your Social Security alone and you're not on his record, you're not receiving spouse benefits, then unlike tomorrow, you actually have to file. So once you find out that person passed away, then you have to file a surviving spouse claim, and you can receive, again, depending on how old you are when that happens. If you're your full retirement age, then you'll receive essentially what he was receiving. On Tamara's case, because if she's on the record, it's automatic. But if you're not on the record, you actually have to file a claim, which is, it's pretty easy. So, Tammy, if I remarry and the current husband has medical insurance that I can get on, can I stop my Medicare and reapply when I'm 65 with no penalties? I'm the one on disability paying huge penalties every month. Yeah, yeah, not A. You can't withdraw from A, but you definitely can from B. So yes, absolutely. If you have health insurance from current work and 20 employees and yada yada yada, then go down to Social Security and tell them that you know that's the case, and you can stop B. And yes, absolutely. Dr. Ed, I'm recently out of work due to spine surgery. Is it true I have to quit my job to apply for SSDI even though I do not receive any compensation and listed as full-time employee? Um, yeah, no, no. Quit your job, but you're on it for whatever legal reasons or whatever the case may be. Then, normally, again, Social Security defines disability as the inability to work based on a disability that's going to last 12 months or longer. But if you're currently working and you're making over the substantial gainful activity, what this year is 1550, then Social Security says, well, you're not disabled. But it sounds like they're keeping you on the books for whatever reason, and you're not making over 1550. So yes, absolutely, file immediately, if not sooner, and watch my videos. So once we finish here today, go to my YouTube channel there, watch my 4 videos I did on disability, and it'll give you all kinds of insider tips, tricks, and secrets on how to file and improve your case. Jimbo, can I apply for mental disability at my job doesn't for they don't have to laugh at my jokes? Yeah. Um, let's see. How would I collect Social Security if I move overseas? If you move overseas, before you move, a lot of people just go ahead and do all the, do everything and file and all that kind of good stuff. But if you're overseas and you want to file, then you can go to the FBUs, which are federal benefits units, and most U.S. embassies overseas have those. And there's also um, Social Security employees that are stationed. Was there about a dozen or so that are stationed? Like one in Manila and another one in Rome, and I think there's another one in London. There's throughout the country that are stationed in actual embassies. They're actually Social Security employees, and they're the ones that kind of help out particular regions and stuff like that. So yeah, just contact your consulate or embassy, and they can do that for you. No problem. Donna, hit the thumbs up, everyone. There's 93 watching, only 36 thumbs up. Oh, only 36. I can never see how many thumbs up we have. So yes, please, everybody thumbs up, because that pays it forward. When you do the thumbs up and subscribe and all that, comment and all that kind of good stuff, then YouTube and TikTok and all these things, they send it out to more people, and hopefully, yeah, people get help. Rosebud. Note to self: if you're working at 65, Medicare bills you 3 months at a time. Yes, that is a fact. But yeah, they bill you 3 months at a time, quarterly, but you can set it up on a monthly basis if you want. Titus Mom, hey, welcome back. Sorry if this has been answered already. So I still sign up for Part A and Part B at 65 if I want to have Medicare be my primary insurance and my current insurance be my secondary insurance. Yeah, absolutely. And if you can figure all that primary insurance, primary and secondary and all that kind of stuff, let me know. Well, actually don't want to know. That's too much, backroom sausage being made. It's a nightmare. The insurance companies, Medicare and your private insurance companies and all that fight about, oh, this particular procedure, it's coded as this on there. If it's coded on that, then Medicare is the primary and we'll pay out, the secondary. And Medicare says, no, you're the primary and we're the secondary on this. And it's just, the whole thing is just a nightmare. And usually what happens in the meantime is you're stuck in the middle, and they send you a bill. The doctor sends you a bill that says, you came in and, had this procedure done, and nobody's paying it. So you owe us $500. And usually what I tell people is, if they got Medicare and all that stuff, and it's covered by Medicare or private insurance, just wait. Wait for it to flush out a little bit. and then the companies will fight behind the books, behind closed doors, and then it'll eventually, hopefully be paid for. So, Jimbo, thanks again, brother Ed. Dinner time in Chicago area. All right, all right. Sounds like a plan. Liza, thanks, Dr. Yoda. You are amazing. Dr. Yoda. Nice. Chris, hey, what's up, Chris? Social Security messed up now, not getting my Medicare until 3 weeks after 65. Does that count for time frame? Yeah, no, that's fine. Yep, no, that's fine. Yeah, usually begins at the beginning of the month. So that you're not going to penalize you will not get penalized for that. That's good. You're good. Greg, I received a wage and employment form. It got destroyed in mail. I called 800 Social Security number and asked for a new one, but I never received it. Should I go to local office and have one printed out for me? Yeah. Wage and employment form. I wonder what you need it for. But yeah, you can probably go online and print it off as well and submit it and whatever you need there. Yeah, you can go to local office. You don't have to wait forever, but or you can, if you know the form number, just go ahead and print it off. Or probably call the local office and ask them exactly what form it was that they're, sent you. And then you can go in there and print it off rather than, go down there and, waste your gas and all that kind of good stuff. Anna, will my Social Security keep increasing if I start collecting it at FRA, but keep working and receive my regular salary? Yes, watch my video I did yesterday on increase your check, 6 ways to increase your check. Yes, it will increase based on COLA, the yearly COLA increase. And then if you continue to work and your work is the high 35 years, then yes, it will continue. And yes, you do have to continue paying FICA forever and ever and ever. Death and taxes, right? So yeah, you'll always pay FICA, even though you're already receiving benefits. And so just Jeff, thank you, Dr. Ed. You have already given me some hope with your videos and answers. I will spread the word about your channel. Thank you. Please give Sir Dr. Ed all the thumbs up he deserves. Thank you very much. I appreciate it. Thank you. Yeah, I never thought I'd be doing YouTube. I know I was helping people out with Social Security, Medicare, and Medicaid, and all that stuff. But someone said you should do YouTube. And I'm like, no. And here I am. I am 59 and on SSDI, have Medicare Part A. Do I have to get Plan B? Not if you have current insurance through work, yours or your spouse's, and 20 employees and all that kind of good stuff. But yeah, because Part A again covers the hospital, so it covers the hospital charges, the room and all that kind of stuff. But when the doctor comes in, that's Part B. Thanks, Dr. Ed, for your expertise and time. So glad I found your channel. I've shared your channel with others. Love your live sessions. I learn so much every time. Yeah, you're welcome. Yeah, that's our job now, is to go out there and get as much information out there as possible. And y'all are doing pretty darn good, because this doesn't help anybody if people don't watch and people don't get the information. So I can sit here and talk all day, but it's y'all that go out there and share and like and share on Facebook and all that kind of good stuff. Tamara, thank you so much. I wasn't sure I was doing the right thing. God bless you. Oh, thank you very much. Oh, Brahman, $5. Haven't met too many Marines that don't drink, but we appreciate your pushing us value information. Here's your caffeine fix of the day. Yes. Thank you, bro, man. I appreciate it. Yes, definitely. Yeah. I told Brahman before my even in the Marine Corps, they called me one beer Weir. I'm such a lightweight. So anyway, thank you. I got my coffee IV for the day. Let's see what else here. Is Part A free? Tim asks. Yes, if you paid into Social Security your FICA taxes for 10 years, 40 quarters, then yes, Part A, the premium is free. But there's all kinds of, you've got, the deductibles and co-insurance and stuff like that with Part A, but the premium itself is free. Let's see. I'm going through my TikTok here and see. Okay, some people on TikTok are answering each other's question. My ex-husband of 17 years passed away. Would I get his Social Security? Sorry to hear that. Yeah, if you have to be at least 60 years old to get survivor benefits, but when you receive survivor benefits or spouse benefits or retirement benefits, you have to stay under the annual earnings limit. So if you're working, making over 22,000 and some change, then it might not be, you know, time for you to collect those benefits. But if not, you can collect it as early as 60 years old. And how much it can be up to 100% of his primary insurance amount, or if he took delayed retirement credits, it could even you could even get the delayed retirement credits if he waited till after he was, full retirement age. Let's see. Once at Medicare age, do I have to take out a Medicare Advantage plan? Um, you don't have to. Once you get Medicare in Part A and Part B, you don't have to, but most people do, unless you're independently wealthy and you've got a few $1 million in the bank. Yeah, people take out either you have two options: Medicare Advantage or Medicare Supplement plans. And Medicare Supplement, you get a G or an N, and Medicare Advantage, there's dozens and dozens and dozens of plans probably in your area. So if you want a Medicare Advantage, if you're looking for a Medicare Advantage, two most important things is you find one that has your doctors that you want to go to are in the network, and that your prescriptions are covered in a good price. And then you look for all the other, bells and whistles and whatever extra benefits they offer. So if you want someone to help you out with that, you can send me an email or call me and tell me your name, your state, because they're all state area specific, your phone number and what you're looking for. And I can find someone in your area that can help you out. And that is a free service. But full disclosure, if you like the options they give you and end up enrolling, then those people support our channel. So I think it's a win-win situation. All right. Can my husband with Parkinson's qualify for Medicaid if we own our home? Yeah, Medicaid. I did a lot of Medicaid, and they most programs, like SSI and Medicaid and stuff like that, they exempt one home because they don't want to kick you out, and make you homeless. So they exempt one home and one car. So yeah, if you have a home, it could be a $10 million home and a Lamborghini, and that's exempt. Doesn't matter. If you have a Lamborghini and a Ford Pinto, then you've got too much. It's crazy. Yeah. But yeah, one home and one car are exempt, so they won't count that at all. So yeah, definitely apply for Medicaid, and you do that through the local Department of Social Services. And you can have Medicare and Medicaid at the same time. People think they're the same thing or they're mutually exclusive. There's millions of people throughout the country that have Medicaid and Medicare. And if you have Medicare and Medicaid, then you're also eligible for what's called a Medicare Advantage dual eligible plan. And those, yeah, people are very happy with those because there's tons of cost savings in there. So check that out. Again, if you need help on TikTok, if you go to my front page, I've got my phone number and my email. So if you want, if you know someone that can help you out with Medicare, and trust, obviously go with them. But if you don't, let me know, and we can find someone to help you out. Tim, okay, I still work part time and have. Oh, okay, wait. I think I answered. I think I'm going back to this thing. Okay. Leslie, hi, Dr. Weir. Thank you so much. I have more questions. All right, perfect. Does your dollar amount continue to increase if you make more money after reaching your full retirement age? Yes, 100%. If it's your high 35 years. So if last year you worked and you made, that's one of your high 35 years of your entire life, then when Social Security gets that notification, through the IRS, Social Security looks and says, "Yep, this is Leslie's. This is one of her high years. We'll throw out the lowest one. We'll put this one in there. We'll recalculate everything, and then, whatever that recalculation gives you another buck or $5 or $10 or $20 or whatever the case may be. And because that takes a little bit longer to do because it has to go through the IRS and all that kind of stuff. So if it happens in April, May, or June, then they'll go ahead and increase it going forward, but they'll also give you that back pay starting in January. So, Sherlyn, hello, I'm new here. Thank you for all the great information, but I do have questions. Do you know anything about medical set aside? Yeah. Each state there is what's called the ABLE Act and all kinds of different things like that, which are I think yeah, it's good system. So it depends on what you're talking about, SSI or Medicaid or anything like that. But yeah, I might have to get a little deep dive on that one time. But they're all a lot of them are state specific. I think pretty much all of them. But yeah, it's basically that if you have money and you're saving up money to do some type of medical procedure or something like that, they don't count that as resources. So, for instance, like SSI, if you have over $2,000 of resources, then you can't qualify for SSI because it's a welfare-based program. But if you're going to be using that for, a upcoming surgery or something like that, and even like the ABLE Act, it's like, well, I want to, save up and, buy a car so I can make my medical appointments, or, I want to even start your own business type thing. And there's all kinds of programs like that. So, but they're all very complicated. So I would probably reach out to a specialist, pick the particular program you're interested in, and then reach out to the program kind of liaison and make sure you're doing everything correctly. Because if you don't do it correctly, and again, same thing with what I just talked about in terms of disability. um, go to the 99-cent store and buy yourself a notebook and said, okay, I talked to this specialist that works at the actual organization, and I talked to them, and they said I could do this, that, and the other. And make sure you make a journal entry of all that. That way, if someone comes back later and says, oh no, then you've got proof that you were actually told that. Let's see. I guess I should have asked, can your Social Security be garnished to pay for a debt? Yes, possibly. That happens a lot with like child support and stuff like that. But yeah, if Social Security has to abide by court orders, and we used to get court orders in our office all the time, and they're kind of a nightmare to do because it's internally it's a nightmare to initiate. But yeah, they conceivably do. And the problem is like alimony and different stuff. When you pay it off and you no longer have that, the court says, okay, you're paid it off and you don't owe it anymore. The court actually has to tell Social Security, sends another court order to Social Security to say, okay, stop it or reduce it or whatever the case may be. You can't walk in there with your new court order. You just get out of court, you run down to Social Security with it and say, okay, here, look, stop. Social Security has to get it directly. So yeah, when the thing ends, it's kind of a nightmare to stop or change. All right, yeah, but if it's a court order, then it really depends on what type of court order it is. Social Security usually has to abide by a valid court order. But usually, if you owe, Target $1,000 or something like that, then usually, it's Social Security. I don't think I've ever seen that type of court order coming through. Usually it's more, public alimony and stuff like that. Child support, lots of child support. All right. Can I work full time if I take my deceased husband's Social Security? He would have been 66 in October. If you are, you have to be your full retirement age. If you're full retirement age, depends on the year you were born and all that stuff. Then you can work full time, make as much money as you want. But if you start collecting those benefits early, again, any benefits, survivor benefits, spouse benefits, retirement benefits, if you collect those benefits early, then you have to stay under the annual earnings limit. If you don't, Social Security will hold back $1 for every $2 you go over. Can I call Social Security and inquire about what documents they have reviewed to determine my pending disability claim? Um, yeah, you can, yeah. But the uh, you're not really calling Social Security for the medical portion of your disability claim. That's done by what's called the DDS, Disability Determination Service, and that's a state agency. So what happens is when you file a disability claim, the local Social Security employee takes that and asks you all the questions of what doctors and what's your disability and were you ever married before and do you have any children, all that kind of stuff. So they take the claim, and then once everything is good, they send it to the DDS, the Determination Service. And those are the ones, that's the organization that gets all your medical records from your doctors and hospitals. And so that's who you really want to reach out to if you have a question about, what type of documents they're getting and all that kind of stuff. The local Social Security really can't help you out with that if that's what you're talking about. Divorced and ex died. Any way around the 10-year rule caring for a permanently disabled child? 10-year rule, no way around that. And you're divorced, so you weren't living with him when him or her passed or missed. So it'd be him. But if you're taking care of a disabled child, you might be eligible for what's called the surviving child in care benefits. You can be any age. So basically, you're taking care of a child of a disabled person or a deceased person. And because you're taking care of that child, then you're not able to work. So Social Security says you're eligible for benefits there. So again, you have to, keep under the annual earnings limit of the $22,320. But if you're not working and not working over that, then yes, call Social Security immediately and tell them that you want the surviving child in care benefits because you are taking care of a disabled child. All right. And see what they say. And there is a family max on that. But if there's only one child receiving benefits, there's a maximum that can be paid out on a record. But if there's only one child, the family max shouldn't be an issue whatsoever. So all right, let's see. My brother has cancer. How can I help him get his benefits? Yeah, wow, sorry to hear that. Yes, please have him file for disability benefits. Watch my 4 videos I did on YouTube on disability. I just did a 4-part series on filing for disability with all kinds of tips, tricks, and secrets. I did that within the last month or so. So watch those 4 videos and immediately file for benefits, with him. If he's not able to do it, you can do it as kind of an authorized representative type thing, representative payee. Everybody, please thumbs up, please, so we can get out to more people. What am I entitled to if I am divorced and was married for 23 years? My Social Security benefits are very low. Yes. So you're receiving benefits on your own record. So you were married for 23 years. If you're not remarried or anything, now then you should be eligible for benefits on their record, on your ex's record, even if they haven't filed yet. If that person is 62 years old or older, you can file for benefits on their record, even if they haven't filed yet. It's called independently entitled divorced spouse. So call up Social Security and say, hey, here's the person. You don't need to know the person's Social Security number or anything like that. You just call up Social Security and say, I want to file for benefits on my ex's record. Here's his name, date of birth as well as you know it, the city and state he was born as well as you know it. And they should be able to find his Social Security number. They'll look and see what his benefit amount is. If his benefit amount is twice yours, then there's some money in there. So they'll give you all that information at that time. And you can go back on any. So if you were married 3 times, they'll look at all 3 ex-spouses and say, okay, first spouse, yeah, no money. Second spouse, a little bit of money. Third spouse, oh, there's money there. So you can go on first, second, third, whichever one gets you the most money. Let's see here. Karen, I think I skipped one. I'll jump back up to the one. Divorced and will be 62 in June. If I get married, do I have to wait another 10 years to collect SSI? SSI is the welfare, but yeah, Social Security on the new husband. No, no, you can, yeah, you can file for benefits. I think you have 1 year and stuff, but yeah, if you're married, you go in there and no, you don't have to wait the 10 years unless you divorce that person. Then you have to wait, but no, when you go in June and you're married at that time, then if if your new spouse is receiving Social Security benefits, then you file a claim for benefits on your own record, and then you file spouse claim on that person's record as well. And they'll tell you, you know, you should be good. All right. Les Paul Morgan. I recently turned age 62, long time on SSDI. Still am and was told that at 62 you can transfer over to Social Security automatically. No, that's at your full retirement age, not 62. When you hit your full retirement age, 66 and 6 months or 8 months or 67 or whatever the case may be, Social Security automatically switches you from disability to retirement benefits. Nothing really changes. Your benefit amount stays the same and you still get Medicare and paydays the same. And, I get, comments all the time. I'm 80 years old on disability. No, nobody, over 67 is on disability. Um, so because they've already switched you. If you want, not many people do this, but if you're on disability and you're tired of the CDRs and the really limited ability to work, and you turn 62 and you want, you're going to be reduced the month amount you get, but you want to be able to work more and stuff, then you can cancel, delete, stop your disability and switch to regular retirement benefits. But I don't see many people doing that. So, let's see here. Leslie, thank you again. More questions. Does your salary matter if you are applying for survivor benefits? Yes, if you're full retirement age, again, you're limited to the amount of money you can make. But in terms of, well, maybe you're asking, does your salary increase your survivor benefits? No, because your survivor benefits are determined by how much the deceased worker paid into the system. But your salary counts because if you make over the 22,000, then they're going to hold back $1 for every $2 you go over. All right, I think I got that question. Let's see. Let's Paul Morgan. When I went to the local Social Security office, they dismissed it because of my age being 62, and that said, no, I have to wait until 67 and a half without looking at the ruling. That states 62. No, I've never seen a ruling that says 62. Again, you can. Nothing's automatic. Well, that's not automatic. You would have to withdraw your disability, stop your disability, and then once you withdraw your disability, then you would file for early retirement and get that 30% reduction. So whatever you're receiving now, you'd get 30% less. So you can do that. Yeah, absolutely. And then you have to worry about Medicare as well. So, hello, I have Medicare Part A only, could not afford Part B. They wrote and told me based on my low, I qualify for free Part Medicaid B, but I missed enrollment. What can I do to get it on free B? Okay, yeah, some states are kind of weird like that. But so yeah, so if you have free Medicare Part B, which it's not free, it's just the state has decided they're willing to pay for it. But some states, I know like Arizona is kind of strange like this, but I would call up Medicaid again because that enrollment period for states, for the most part, doesn't apply. So, you don't have to wait till January, February, March. If the state is going to do it and they're willing to go ahead and do it, sometimes they can just go ahead and do it without having to wait for any special enrollment periods because they're the state government. So I would call up Medicaid again and say, hey, you know, I think you said you're going to pay for my Part B. Let's do it. Again, that's that Medicare savings program. And then if you get signed up for that, if you have Medicare and Medicaid, then you can get those Medicare Advantage plan, the dual eligible plan. So give us a call and let us know, and we'll go through all your options of all of those. Okay, let's see. All right. Um, Don, Medigap versus Medicare with Federal Blue Cross Blue Share. What's better? Yeah, way too many variables there. Yeah, so your federal federal employee health benefits. It sounds like, yeah, there's too many variables there. It depends what your insurance looks like and all that. Luz, learned so much watching your videos. Thank you. You're welcome. My FRA is 67 and I plan to keep working with full health benefits. Can I apply for my benefits at 67, keep working, and bank my Social Security checks? Yep. Or you can send them to me. Either one. Yeah, absolutely. Yeah, absolutely. What you do with it when you get it is no problem whatsoever. But if you're looking at banking your Social Security checks, well, I guess if you can make better than 8% per year guaranteed, then yeah, collect your benefits and I don't bank it. I wouldn't bank it. I would, invest it, because if you don't need the money at 67, um, then I wouldn't take it, because starting at 67, you get those delayed retirement credits, and that's 8% per year guaranteed. So if your benefit is, let's say make it easy, $1,000, when you hit your full retirement age, after 3 years, you get $1,240, a 24% increase. So, yeah, that might be something you want to kick around. Does the stimulus checks go against you when on SSDI? On SSDI, nope. You can make, yeah, that's unearned income. So, and watch out, please, for all the clickbait out there, all the, oh my gosh, all the YouTubers and TikTokers and websites that said more money and you're going to get 2 checks. And there's another one. Just, you're getting 2 checks next month or this month. Yes, you are, because June 1st falls on a weekend and therefore it's going to be paid on May 30th. You're not getting 13 checks this year. You're getting 12 checks. I wish these people would stop all the clickbait, because it does a disservice. Because when I worked at Social Security, every time some YouTuber or TikToker or whoever said some crazy thing like that, people would call up Social Security and, where's my check? Where's my free ice cream and unicorns that this guy said was coming? This extra $1,000 and stuff like that. And we'd have to explain it's just clickbait and it's just someone trying to get you to watch their channel or whatever the case may be. And yeah, and that we could have spent that time actually helping people out. So that's one of the reasons why the customer service is so bad, is because we're answering all these stupid questions. Sorry. So yeah. So yeah. So there's that. All right. Okay. David. What's up, David? I signed up for Part A and Part B in January, collecting Social Security starting in January. I have insurance through work until May. I have a supplement plan starting in May. I hope I do. I hope. Do I need to sign up for D? Yes, 100%. If you have a supplement plan, good job. Plan G or N, awesome. But yeah, often people that sign you up don't tell you. They don't spend the extra time to tell you about the Part D. So yes, you have to sign up for Part D. If you don't, I don't take any medication, so I don't need it. Well, it's like car insurance. I don't intend on having a car accident this year, so I don't need car insurance. Yes, you do, because it's mandatory. And so you paying the premium for car insurance pays for people who have car accidents, right? So same thing on Part D. But the good news is, this year, I know there's plans out there throughout the country, some of them in particular parts of the country, that the premium for a Part D plan is like under $1, or so I think there was 0 ones and 50 cents one, and under $10, or so again, it really depends on your particular area and everything like that. But yeah, so it's pretty inexpensive. But you definitely need to sign up for Part D, even if You don't take drugs. Prescriptions. Sorry. Greg, how do you talk to a claim specialist? Yeah, to talk to a claim specialist, yeah, when you call the 1-800 number or your local office, you get a customer service representative. When you pretty much the only time to talk to a claim specialist is if you walk into the office and have to go through the first, you know, person and say, well, I'd like to talk to a claim specialist, and they'll send you to the, and before it used to be the back room, but now they're pretty much all windows. But if you schedule an appointment, but for Social Security, you can't schedule an appointment unless you actually are going to file a claim. 99.9% of offices out there, you can't talk to a claim specialist unless you're actually taking a claim. So if you're not going to be taking a claim, the only way you can talk to them, is go into the office, unfortunately. Leslie, if working until 67 now, but you make more than 22 a year and your spouse sadly dies, he was 72 and earning Social Security, can you get survivor benefits without being penalized for making? Yeah, if you're over your full retirement age, so you're 67 now, no, you can collect survivor benefits and get the full amount. And if he was working till 70, then he probably has the full delayed retirement credits, and you also get those full delayed retirement credits. So basically what he was receiving, that's going to be your check because you're 67 now, and you can make $1 million a month and collect survivor benefits. And since your benefits are not going to go up anymore because you're 67, please call immediately, if not sooner, and start those benefits because they're not going to go up. COLA increase, but that's going to happen regardless. So please, yes, get those benefits. I plan to keep working past 67 with you. Yeah, yep. My retirement lasted about a week. Here I am. Let's see. I got some TikTok questions. How much money can you have in the bank if you're 67 and you're on SSI? Yeah, usually it's a couple $1,000s for SSI. And when you file for SSI, you file authorization for Social Security to check that. So if they get a listing, I forget what diary code it is. But anyway, but yeah, if it pops up that they do a regular check of your bank account and it pops up that there's more, then you got some splaining to do. Rose, what's up, Rose? Do you get regular Social Security retirement, or you? Oh, okay. Someone's answering someone else's question there. So I'm again. Please, TikTok. I need 10,000 subscribers so I can do you all better here. And some people are answering other people's questions, and I don't know if I can't go through there right now and see if they're correct. Can you cancel Part A if working and reapply penalty free when you fully retire? No, I wouldn't cancel Part A anyway. Now you can't because it's free. So Part B, that's the one that cost you. But yeah, you can do Part B. But yeah, you can't cancel Part A. I delayed retirement until 70. I continue working. Would Social Security recalculate my Social Security? Up until 70. Your benefits aren't increased after 70. You don't get the delayed retirement credits anymore, but you get the COLA. Watch my video I did yesterday on this. You get the COLA, and if you continue working and continue paying into Social Security, and that's one of your high 35 years, then yeah, it's automatic. You don't have to do anything. You just pay your taxes, and then when the IRS notifies Social Security that you made X, Y, or Z, then Social Security automatically looks at it and sees, yeah. All right. Wow, I think I've answered. I think. All right, this will be the last one. I plan to keep working past 67 with full health benefits. Do I have to sign up for Part A and Part B at 65, even if I have benefits from my job? I work for municipal government. Yeah, no, if it's through current work, not a retirement plan or anything like that, yeah, if it's through current work, then you don't have to sign up for Part A or Part B. And then when you stop working and stop receiving health insurance from current work, then you do have to sign up. If not, then you get the penalty for the rest of your life. So, all right. I think we did a pretty good job with all the questions there. Thank you all for all your help and the coffee money. I sure appreciate it. And go get my IV right now. All right, y'all take care and have a beautiful night.